Thank you to OIS again for having me to the Innovation Showcase, which I guess now has been renamed the Dr. Karpecki Showcase. With that, I'm here to talk about macular degeneration. As you know, that's a slow loss of central vision, but you do retain your peripheral vision. And we have been working on an augmented reality visual aid. And the point of this is not only does it help optimize that peripheral vision, but it's a natural viewing experience. It does not inhibit the wearer. It does not block their peripheral vision, so they retain full mobility and effective full field of vision. So as we know, AMD is one of the large unmet needs in the eye care world, with the leading cause of blindness for people 60 and older. And of course, 90% of that is dry AMD with no cure or therapy. And as one of my co-founders says, his worst day in the retina clinic is when he has to diagnose someone with AMD and says, "I'm sorry, there's nothing I can do for you, but go see a low vision specialist," and they give him some sort of magnifying device, which of course helps in some ways, but further inhibits their field of vision. So what we are is fundamentally an augmented reality hardware that we use open market hardware with our proprietary software. This is not a new concept. It was pioneered by NASA over 25 years ago. But what separates us is our adaptive systems, not only adapting to the person's visual deficits, but also their habits and environment. So we did run a clinical trial, although not required by the FDA. We've seen somewhere between 50 and 100 users up to this point, but the clinical trial was focused on two main endpoints. First, we were looking at improved tasks of daily living, and secondly, visual acuity, of course. And the tasks we picked, we wanted to make sure we looked at a variety of our features and see which ones were impactful, but also under a variety of conditions. So here you can see the improvement in time tasks, anywhere from 35 to 50%, but this somewhat undersells the effectiveness of the device. Because what we found is only about 1/5 of the people could do these variety of tasks, both close-in tasks, intermediate tasks, and far-away tasks with their normal glasses, and over 5 times that was able to do that with the Eyedaptic glasses. So that was a big win for the users, certainly on the efficacy front. We also measured visual acuity in reading situations. And here, just comparing it, for instance, to some of the leading drugs out there for wet AMD, you can see that we were able to gain, on average, 18 letters. We did not select for any type of scotoma. So this was across a variety of scotomas, both sizes and shapes. And you can see roughly the 2x improvement in visual acuity. But most importantly is how's the usage. So this is a variety of our users. We have over 500 hours on our device. Anywhere from up in the left-hand corner, this is Brian. He was a computer programmer. He is 2200, so legally blind. He's able to use his computer again and uses these glasses every day. Lainey, down the bottom corner, is a teenager with Stargardt's disease. She's 2400, and this was a picture of her at a New Year's party where she was able to see her parents' faces and expressions again. Joy is a senior citizen. She's in assisted living. She loves to be able to see things again, and she also loves telling everyone else about her new glasses. And then Lowell, up in the upper right, brings these to the store, where he can navigate the store, keep walking around, but also look at labels, signs, and anything in between. So we are now officially in the market with our entry-level device. This is targeted through the optometry channels for the intermediate stage macular degeneration patients. And then later on this year, our premier device is targeted for those low vision patients in the late stages of macular degeneration. Again, I wanted to thank a fabulous team, especially on the eye care side, Dr. Karpecki in optometry, Dr. Kammer in low vision, as well as Dr. Cooperman in retina. So we have demonstrated the prototype and validated that a couple of years ago. We finished our clinical trial last year. We did begin our beta launch at the end of the year. We are now in pilot, so this is available on the open market, and we're planning to release our second product in the second half of this year. So with that, I wanted to thank OIS and all the eye care support we've gotten over the years, as well as our early stage investors in the angel groups. So thank you very much.